Good afternoon. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, Somerset. Welcome to today's webinar on National Maternal Health Awareness Day, Keeping Your Mom and Baby Healthy, presented in collaboration with Friends Health Connection. Every day, 2 women on average die in the United States following childbirth, and 1,000 women per week are affected by severe complications after having a baby. Native American and Black women are 2 to 3 times as likely to die from pregnancy-related causes. More than 60% of maternal deaths are preventable. With maternal mortality on the rise in the United States, January 23rd is designated as Maternal Health Awareness Day to promote awareness of maternal health issues. During today's webinar, we will discuss complications that may arise from pregnancy and childbirth and tips from keeping mom and baby healthy. Our guest today is Haydee Alvarez, Nurse Manager for Maternal Child Health Services at Robert Wood Johnson University Hospital, Somerset. Thank you for joining us.
Thank you for having me, Serena.
So, and thanks again, Haydee. We are going to begin today's webinar with 20 minutes of moderated discussion, followed by questions from our audience. So, Haydee, let's begin by having you tell us and tell the audience a little bit about yourself.
Serena, as you mentioned, my name is Haydee Alvarez. I am the nurse manager at the perinatal department at Robert Wood Johnson, Somerset. I have 16 years of nursing experience. Half of those years are in perinatal department. The other half are on neurosurgery, ear, nose, and throat, medical, surgical, and home care. I also have my Master's of Science in Nursing and Leadership and Management, and I am also a certified nurse in perinatal department.
Well, great. Thank you so much. You have a ton of experience, and we're so happy you could join us today. So let's start off by talking about what are some of the complications that can arise during pregnancy and childbirth?
Well, some of the complications that could arise during pregnancy are high blood pressure, gestational diabetes, and preterm labor. Some of the complications during childbirth could be fetal distress, can be bleeding, could be failure to progress or dilatate. So those are the common things you want to look out for during childbirth and pregnancy.
So then what can cause these complications, and conversely, how can you prevent them?
So I'll go into details with fetal distress. Fetal distress, it can be an umbilical cord pressure. It can be a temperature in the mom's a temperature in mom. What we want to do with fetal distress is make sure the mom is hydrated. We want to make sure we are repositioning the mom. We want to make sure we are providing oxygen for that type of case, fetal distress. But failure to progress, there is not much we can do. Failure to progress, for those that don't understand what that means, is being able to reach to 10 centimeters. And if that does not happen, you are led to the OR for a C-section. So that is unavoidable. What we try to recommend moms to do while they're laboring and it's taking a long time to labor is rest as much as they can, relax, unwind. That is pretty much the only thing we recommend moms to do when we are in the labor room.
Okay, well, thank you so much. So what are some of the signs and symptoms that you look for after childbirth that may indicate like an infection?
So you always want to look out for fever. After delivery, you want to make sure you do not have a fever, you're not bleeding excessively. You do not have vaginal smelly discharge. Okay, that's something very important. You want to make sure your pain is not increasing as the day goes by, and you want to make sure you do not have pain in your abdomen. These are the things you want to report to your nurses and things that you want to report to your obstetric doctor, even if you are discharged home.
Okay, well, that's very good to know. So new moms may think that, that what they are feeling is, typical after childbirth. So what are signs that something is not right?
So most moms do tend to get the menstrual cycle after delivering, and this might be typical. It is typical for mothers. So if you are excessive bleeding, which is saturating a pad within an hour, that is something to definitely report to your obstetric doctor. So again, moms might think this is a typical thing because you are supposed to get your period or menstrual cycle after delivering, but if you are saturating your pad within that hour, it is something to report.
Okay, that's good to know. And so what should family members then look for? Is that the same thing, or, maybe can you elaborate not just about physical, but, maybe some of the psychological things that, women may experience?
Right. So the symptoms I just repeated, physical, we can go into physical, we can also go into emotional assessments that family members can assist the mom with. Physical, you again want to watch for fever, headaches, make sure the mom is doing well, discoloration, because when you tend to bleed a lot, you tend to change in color. So whoever's there with the mom can observe that by looking at her. You want to make sure that the mom is happy. Right? A lot of postpartum depression happens when you go home. You want to make sure that the mom is motivated, that the mom has help. If you are noticing that the mom has no motivation or not happy about bonding with her child, you also want to report that to the obstetric doctor.
Okay. Oh, thank you. And that's really good to know. And that's important. We want moms to be happy and healthy after childbirth. So what are some resources that we have here at Robert Wood Johnson University Hospital, Somerset, to ensure the health of mom and baby? So can you maybe elaborate about our 24/7 services, the neonatologist, things like that?
Oh, yes. So we provide great service. We do have a neonatologist, we have an anesthesiologist, an obstetric doctor, 24 hours, 7 days a week. We do have nurses who are here day shift and night shift. We have level 2 nursery nurses who are certified to care for level 2 NICU babies. Okay, so we provide all the services that mothers are looking for to have a healthy and fruitful pregnancy and delivery.
Very good. And that also includes, anesthesiologists as well, correct?
Oh, yes, we have an anesthesiologist as well.
Yeah.
24 hours, 7 days a week.
Okay, well, that's good to know. And I don't know, for me, I always was interested that we had the level 2 NICU. I think that's one of the things I never really realized before. But when I had started having children, I was pleasantly, not surprised, but just very pleased that we had.
Right.
So what are some precautions that we or the hospital is taking during COVID-19, and specifically on the maternity pavilion, to prevent the spread of the virus? Because COVID right now is, the numbers are really high, and I'm sure that's probably weighs a lot on a mom's mind.
Absolutely.
Mom's mind.
Robert Wood Johnson Somerset is doing a fantastic job with screening every visitor that comes through our building. So they are pre-screened, they are asked questions before entering our building. They are escorted to the 1 South elevator and into our unit. We do, once they get to the labor and delivery department, we do screen our parents, okay? So the mom's temperature is taken, so is the significant other or the person that's accompanying the mom at the time. We tend to check their temperatures every 12 hours. That is for the significant other or the person with the mom. Moms, we usually tend to check it every 2 to 4 hours, okay? So those are for regular non-COVID patients. We tend to do those things. For patients that are scheduled for C-section, scheduled for inductions, we actually do a pre-test of COVID before arriving to the unit. So that is required 48 to 72 hours before coming to labor and delivery. So we should know the results by then. For those moms that are arriving in labor, right? You sometimes cannot predict when they're going into labor, even if they're scheduled for a C-section or induction. We tend to do a rapid test in the unit. While we're waiting for those results, that patient and the person with the patient is isolated, just to promote safety and to make sure that the patient, the staff, and everyone's safe and healthy.
So thank you. And you talked about a lot of what we're doing for the moms. Can you share some of the stuff that we're doing with the staff? Like, you're in a mask. So can you maybe talk about some of the cleaning techniques and things that are used, that we do, and how the staff are also protecting themselves? Can you elaborate?
Oh, yeah. Absolutely. So staff are required to wear a mask at all times. In our labor and delivery department, we wear the face mask or the goggle the whole shift. We wear our gowns. We wear a head cap as well to protect ourselves. We have a great environmental service who makes sure our rooms are always disinfected and always cleaned. They tend to assess the room every 4 to 6 hours, even when patients are in the room. And these are for non-COVID patients.
Yeah, and thank you for sharing that, because by our team doing that, we're also, not only are we protecting our team, but we're also protecting, you know, mom and baby. And that's important. All that is important. So now, let me ask you this. You mentioned testing, and that, you know, so that moms do get tested. So what happens if a mom does test positive for COVID-19? Can you share like what our process is there?
Absolutely. So once a mom tests positive for COVID, we tend to isolate the patient into her private room. Okay. We try to limit people entering the room. It should only be the primary services for that patient. So the primary care nurse and the primary doctor should be the main focus of providers going into that room. Whoever tends to go into that room has to be PPE gowned. Like I said before, head cap, face mask, or goggles with your N95 mask and your gown. Gloves are very important. You have to wash your hands, disinfect before putting your gloves and after removing your gloves. Once the patient delivers, we cohort the baby. We make sure the baby is with the mom at all times, unless the mom is very symptomatic.
Okay, well, that's really good to know, because that was going to be my next question, but you answered it for me. Thank you. So what role does prenatal care play in maternal health outcomes? If you can share that.
Absolutely. Prenatal care is so important. I mean, it decreases the risks for complications, potential complications during your pregnancy. You want to make sure you're always visiting your doctor. The main concern is, again, by visiting your obstetric doctor during that whole 40-week of being pregnant, you are decreasing that risk of any type of complications during the 40 weeks. So that's really the reason why we promote prenatal visits.
Very good. Now, what are some of the tips for women to stay healthy while pregnant? And again, especially, you know, if you could give me tips in general, and then if you could also expand upon tips amid COVID, because that, I'm sure, adds another level of complexity.
Yeah. So tips while being pregnant, you want to make sure you're eating well, right? It's something that even when you're not pregnant, people are promoting to one another. So you want to make sure you're eating well, consuming your proteins and vegetables. You want to make sure you're taking your prenatal vitamins. That is very vital when you're pregnant. Prenatal vitamins are pretty much mandatory by your obstetric doctor. Want to make sure you're exercising regularly, drinking, hydrating, minimize caffeine. You want to make sure you are not drinking alcohol. So these are major tips that obstetric and the obstetric nurse will tell each and every patient during their 40 weeks of pregnancy.
Okay, and what about COVID? What tips should mom do to keep mom and baby healthy? Again, would you recommend the 4 W's? You know, wearing your mask, washing your hands regularly, watching your distance, and if you're
right
home.
Keeping your distance. You're on point, Serena. Definitely want to promote the W's. You want to make sure you're not exposing yourself and your baby to other people. You know, limiting visitors to your home. That's very important. I know a lot of people are excited to see the newborn and to visit the family and offer help. But at this moment, it's good to limit to one person in your home, because now you have a newborn who's building an immune system, and you want to make sure that the baby is safe and healthy, and that the mom and the dad are safe and healthy as well.
Sounds good. Now, my last question, one of my last questions is breastfeeding has significant, we know that has significant health benefits for both the moms and the babies. So can you tell us more about the benefits of breastfeeding, and what breastfeeding support do we offer for our new moms?
So we do have a lactation consultant in our unit. Her name is Rachel. She is fantastic. She is available all week. And even if you do not get to see her at nighttime, because we do not have a lactation consultant at nighttime, it's mostly during the day, you can meet with her and schedule an appointment with her during the day. And she's also available to even provide phone services. So a lot of our patients might deliver and leave probably the next day, she is willing and able to call the next day and provide all the services and answer all the questions that mom will have when they return home. In terms of breastfeeding, what are the benefits? So many. Breastfeeding decreases ovarian cancer, decreases breast cancer. The main one that people are so excited about is losing weight. Moms are always worried about losing weight right after. So breastfeeding promotes 500 to 600 calories. You burn 500 to 600 calories a day. So that's beneficial for the mom. For the baby, it actually decreases allergies if you're breastfeeding your newborn, okay? It builds a great immune system for the baby as well. So breastfeeding has a lot of benefits for mom and a newborn.
That's great. Okay, so I know I've asked you a ton of questions, so I also do want to give our audience opportunity to ask you some questions. So if any one of our members of our audience does have a question, please feel free to type it in the chat feature, and I will be happy to ask that of Haydee. And why I'm giving our audience an opportunity, Haydee, to ask some of their questions. You know, maybe if you could, I'm not sure if you would know, but you know, when, you know, a mom is pregnant, is there any risk, you know, if mom does come down, I think you kind of touched on it, comes down with COVID, is there any risks to the baby during that pregnancy?
So as of now, there are no concrete studies or research evidence-based practice that tells us that there is a risk to the newborn. Okay, so that's pretty much what's going on now. We're still researching. When we do have an answer for that, we will be able to provide it to all moms. So that's why we are keeping standards. We are making sure we're washing our hands. We're making sure we're wearing our mask, our PPE gowns, just to avoid any risk towards the newborn, just because of the fact that we do not have any evidence-based practice promoting that there is a risk of transfer from mom to the newborn.
Okay, so if you were to give a new an expected mom advice, like what is the single most important thing that mom could do to keep her and baby well and safe during this time?
Again, my main advice to these moms would be limiting who they surround themselves with. Okay, we promote hand washing, we promote masks, but that is the most important thing, because if you are not exposing yourself to other people, it is limiting the spread of the virus. It would just be you, your partner, and that newborn.
Yeah, great advice. And that's got to be, I'm sure that's got to be tough, right? You know, with you know, a new baby, you know, parents get excited, grandparents get excited.
Absolutely.
And they want to, you know, share the child, you know, with their family, you know,
right,
member of the family. So that's got to be tough. So do you recommend, in order to be able to build those connections, are you saying, would you recommend virtual connections versus the in-person connections in terms of doing a Zoom with baby? Or if, sorry, I know I always say we have two-part questions, and if, you know, and if somebody is adamant about visiting, what recommendations would you make? Do they get a COVID test, a negative test? Do you take their temperature at the door? Like, what would you recommend?
Yes, Serena, that's actually a good advice. That's what we recommend even for non-pregnant families. You want to quarantine 2 weeks before making that visit, correct? You want to get tested, and you want to quarantine probably 2 weeks after, just to be on the safe side, okay? Because sometimes your results could be negative, but you still want to be safe. It's a newborn we're talking about. So again, quarantining 2 weeks before, taking that test, and quarantining 1 to 2 weeks after if you are such in that desire to visit the mom and see that newborn. Absolutely.
Sounds good. So post-pregnancy, you know, after mom gives birth, again, what are recommendations, again, to keep baby well? From there, I know, you know, typically, you know, your specialty is, you know, you help mom give birth, but knowing that, you know, your background, that you've been kind of in healthcare for a while, what recommendations would you generally tell mom once they get home?
So you always want to follow up with the pediatrician after getting home. So recommended is for a newborn to be seen 2 to 3 days after discharge of the hospital. Okay, and after that, the doctor will pretty much go over everything that's required to keep that newborn healthy for the mom.
That's great. Great advice. Okay, so I'm just wanted to double check any additional questions. And I'm not seeing a lot of questions. So it must be a quiet audience. Does anybody have any questions for Haydee? If you do, please type them in the chat feature or the Q&A section, and I'll be happy to ask them of Haydee. It's your opportunity. So I'm just checking. I'm sorry, I got to go around my camera to see. No questions. Well, I'm going to give everybody a lot of time back then today. I don't think we have any questions from our audience members. So if there are no questions, then I'm going to say that this concludes today's webinar. Please remember that the opinions expressed here by our medical expert are not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral line at 1-888-724-7123. And for more information about Robert Wood Johnson University Hospital Somerset's maternity services, including a virtual tour, visit our website at www.rwjbh.org/Somerset. So Haydee, thank you so much for joining us today. We appreciate your time and the great information you shared. And for all of our expecting moms and new moms, we wish you health and be well. Safety, remember the 4 W's, wear your mask, wash your hands, wash your distance, and when sick, stay home. Thanks for joining us, ladies and gentlemen, and have a great day.